Now, once Mama Lucy Kibaki Hospital and the Kenyatta National Hospital investigated for culpability in the wrongful deaths of the late Edward Onyango, Maureen Anyango, and Travis Maina. The committee wants a review of the Kenya Medical Practitioners and Dentists Act to provide for professional indemnity and compensation of victims of medical negligence, saying there needs to be improvement on how public facilities attend to emergency medical cases. The story was produced by Joroge Gatete.
8 months after the Senate Health Committee commenced investigations into the alleged deaths as a result of medical negligence at Mama Lucy Kibaki Hospital and Kenyatta National Hospital, the committee has concluded the probe. In its findings, the Jackson Mandago-led committee wants Mama Lucy Kibaki Hospital investigated for culpability in the wrongful deaths of the late Edward Onyango and Maureen Anyango. In Edward's case, the committee noted that there was proof of medical negligence at the facility as nurses who were at the accident and emergency section failed to assist the victim who was bleeding. The committee wants nurses who are on duty investigated by the Nursing Council of Kenya and held accountable for mismanagement. It further states that the CEO and the management should be held liable for failing to ensure provision of emergency treatment and care at the facility. In the case of Maureen Anyango, who passed on at the same facility on September 9, 2022, after bleeding following the delivery of her twins, the committee wants Mama Lucy Kibaki Hospital investigated by the relevant health regulatory bodies owing to proof of medical negligence. Senators further want the Ministry of Health, in collaboration with the Kenya Medical Practitioners and Dentists Council, to inspect the facility with a view towards recommending a technical classification commensurate with its actual level of healthcare service delivery. The committee has also urged the Nairobi County government to take urgent action to address the personnel, infrastructural and health financing needs of the facility. The circumstances leading to the death of the late 2.5-year-old Masters Travis Maina at Kenyatta National Hospital on October 10, 2022 is another case that the Senate Health Committee was probing. The senators have called for investigations over the incident, saying there is proof that it was a case of medical negligence. Master Travis, who had a fork jembe lodged in his head, had been rushed to the facility after being referred from Thika Level 5 Hospital. However, there was an unavoidable delay of at least 12.5 hours from the time he was admitted at KNH and when a decision was reached to take him to theatre. In this case, the committee also wants the CEO and the board of Kenyatta University Teaching, Referral and Research Hospital held liable for prioritizing monetary security over the admission of patients and the provision of emergency care. Senators say the issue of prioritizing money is what could have hindered access to the timely referral and transfer of the late Master Travis Maina. The committee wants the recommendations to be implemented within 3 months and the relevant bodies to probe those culpable and disciplinary action instituted.